Republicans in the State House proposing their own plan today to combat COVID-19.
Fox 17's Michael Martin spoke to one of the representatives behind the plan, who says the idea, Michael, is to give more control to local jurisdictions to evaluate and respond to conditions within their own community. Michael.
Yeah, guys, that's right. So far since the pandemic began, these health orders have come either from the governor's office or from the State Department of Health and Human Services. It's an approach that Republicans have referred to as a one-size-fits-all approach to dealing with the virus. The plan proposed on Tuesday, though, by Michigan House Republicans would give more control to local health officials at the county level.
Good morning. I'm Representative Ben Frederick.
Following the Michigan Supreme Court striking down executive order extensions issued by Governor Whitmer at the beginning of October, State House Republicans on Tuesday proposed their own response plan to COVID-19, one that would give more power to county health officials to decide what health orders are in place within their counties.
Our charge was to ensure that we put forward an ongoing COVID response policy which achieved specific goals. Greater transparency, answering the questions people have about what, why, and for how long.
Representative Ben Frederick spoke with Fox 17 Tuesday following a press conference. He says while they have reached out to the governor's office in regards to working together on their plan, they have yet to have any meaningful interactions on it.
I think it certainly was the court's expectation, and it's the expectation of the public, that the legislative branch and executive branch work together. And now I think is a ripe time. We certainly have an open hand to work with the governor in this process.
This GOP plan would give local health officials the option to modify their COVID policies, such as changing the size of gatherings allowed within their county if local health data indicates it's safe to do so.
We're trying to move past an era of geographic captivity where people feel helpless and hopeless as they're, lumped in with broad swaths of territory, and allow for some nuance to come to a county that meets certain base metrics and maintains those metrics.
Before modifying any established thresholds, counties would have to meet specific metrics, such as requiring the rate of positive tests over a 2-week period be below 5%, and that hospitals have adequate bed space and PPE supply.
We've reached a point where it's just kind of this ongoing melees. And so this plan is seeking to reestablish the goal as preservation of our healthcare capacity, following best practices, but also sharing with the public.
And so at this point, it's still unclear if the governor is going to move forward within this plan. We did reach out to her office, but are still waiting for a statement back. For now, though, live in Kent County, Michael Martin, Fox 17 News.